In the name of Allah, the Merciful, Dr. Hamza Alsayouf, pediatric brain nerve consultant. Today we discuss in episode 8 about first aid for convulsions or seizures when they occur. Of course, the first time a seizure happens to a child, it obviously is a terrifying situation for the parents. Parents often fear, God forbid, that their child, I often hear this talk from parents for the first time due to lack of experience and absence, nothing but foreknowledge in such cases. Always in the event of convulsive or seizure episodes, especially the grand mal seizures where the child has significant convulsions. Every start, the point is very important. You must calm down, don't panic, calm your nerves. Secondly, delighted, stay away from the danger source. If he is at a pool or by the edge of water or next to it, in the kitchen and the mother is cooking, and I have a hot iron, I always take it forever and ever away from the source of danger. I put it on his right side. Don't place anything in their mouth, especially not on the north side. And do not try to open his jaw, because even the child is in a state of rigidity. The weather, the jaw can breathe, and putting anything in the mouth could lead to a disaster. For example, this muscle, the muscle they called masseter. Putting a finger could have meant a finger cut off, and forms the airway if you put a splint like they did in the studies in America. And the severity of this excuse might suffice. If it breaks and the stick enters the throat or the roof of the throat or the respiratory tract, do not worry about it. Don't try to put anything in his mouth and lay him on his side. Now, if the situation is known to you and you have a medicine used when needed, it's very important that I own it nervously. After 3 to 5 minutes from the incident, or if the condition occurs for a minute or two and repeats, I'll give him a suppository called rectal diazepam suppository.
Or we give the anti-seizure medication artistically to stop the seizures.
And immediately after, if it's their first incident, they'll be taken to the hospital. Please, if you're taking the patient to the hospital, stay calm, because it's to avoid any other disasters like accidents or any family stress that could lead to a problem while driving to the hospital. If the child's condition is known, we give the download and communicate with the doctor. Based on communication with the doctor, deciding the next step is very important. If I had a child and this child is on medication, and this child's convulsion, I need to adjust the medication dosage. Many parents tell me, "Doctor, my child had 3 convulsions since the last visit. There is no God but you." So I ask, why didn't you find me? Because our goal is to try as much as possible to control the seizure, meaning if you had a seizure at the time, or in this case we are not seized, controlling the seizure, you must increase the mentioned dose. We start quickly, continue quickly, and gradually increase until we reach 3 meters, either to reach the ultimate elegance or extinguish the equation by carrying the medicine or the seizures stop before I add another drug. This way we cover the general guidelines for seizure cases or first aid, always and forever. For parents with a child having seizures, they should, which is basic life support. Learning how to deal with the basics in case of conflict or any other emergency situation. Thus, we conclude the 8th episode. God willing, wait for us in the next episode. God willing, I hope you have benefited from this video. May God reward you all well and grant you health.